Namaste students, हमेशा खुश रहो बिटिया. I am JV'n's Dr. Neeraj Dholia, Faculty of Agriculture and Veterinary Science, Jayoti Vidhyapeeth Women's University, Jaipur. So we are here to discuss the topic, the typhoid, and this topic comes under the subject medical biotechnology. In the previous lecture, we were discussing about the disease, and it was incomplete. So let's start. So we have discussed the reason of the typhoid. It is caused by the bacteria Salmonella typhi, main causating agent of this disease, and it generally resides in the intestine and the bloodstream of the humans, and it spreads to the human to human, exclusively human to human. No vector is available for this, and it is fatal if it is untreated. And this Salmonella typhi um, uh, have entered through the through into the bloodstream, and it can affect the other tissues of the body also. So the main symptoms were the fever and rashes, and the fever may reach to 39 to 40 degrees Celsius, and it may cause the rose colored spots in the neck and abdominal part. And the other symptoms which are not very common can include the weakness, abdominal pain, constipation, headache, and the diarrhea and vomiting. And same similar bacteria is also there, that is the Salmonella enterica, which can cause the similar symptoms. So let's talk about the treatment part. So in the treatment, we can use the antibiotics, and it is necessary to use the antibiotics because in the absence of the treatment, it can be fatal. So the ciprofloxacin can be prescribed for the non-pregnant adults, and other antibiotic is the ceftriaxone. So other than the antibiotics, it is important to rehydrate it by drinking adequate water. And in uh, if the conditions are worsen and more severe conditions, surgery may be required to treat the disease. So there are some antibiotic resistant cases also for the typhoid, like the trimethoprim sulfamethoxam, and ampicillin resistant typhoid is also there. So these antibiotic resistant bacteria of typhoid may show the antibiotic resistant, and they will not um, show the increasing improvements in the patients. Ciprofloxacin, one of the key medication for typhoid, and it is also experiencing these similar difficulties, that is the antibiotic resistant cases. So what about the prevention? So vaccination is also available for the typhoid, and if someone have the planning to travel for the long travel, it should uh, have the vaccines. So oral vaccine is there, a live attenuated vaccine, and it consists the 4 tablets, one to be taken every second day, and last of which is taken 1 week before the travel. So the short and inactivated vaccine also there. So it is administered 2 weeks before the traveling. So it is important to eliminate the typhoid completely, because even when the symptoms of typhoid have passed, it is still possible that we have the bacteria. So this makes it hard to stomp our disease, because carrying whose symptoms have finished may be less careful when washing foods and interacting with others. So if the symptoms are gone, but still you have to complete your treatment, because in the non-symptomatic condition, you can spread the disease to the others. So how to avoid the infection? So take care about handling the foods, drink the safe water, and consume the safe food and avoid the street food, and drink while drinking, avoid the use of the ice. So hygiene is very important. Avoid raw fruit and vegetables. Peel fruit yourself and do not eat the already peeled fruits. So hope you are satisfied with this illustration, and if you have any query, please write in the comment box. In the next lecture, we will discuss the diagnosis, how the diagnosis of the typhoid is completed. And this session is powered by Digital Version 2, Jyoti Vidhyapeeth, Women's University, Jaipur. Thank you.